Hi, I'm Martin Dockrell. I'm Tobacco Control Lead for Public Health England. This year in the UK we're introducing standard packaging for tobacco products. We're the second country in the world to do it. Now, obviously this represents an opportunity to discourage young people from starting to smoke and creating a tobacco-free generation. But also it presents an opportunity, a national teachable moment to help smokers to quit. Today I'm joined by Deborah Arnott, Chief Exec of Action on Smoking Health, Shirley Kramer, Chief Exec of the Royal Society for Public Health, and John Britton, Professor of Nottingham University. So, it's been a long time getting here, Deborah. Tell us a little about the campaign, the road to standard packs.
It has indeed been a long time, and this is something that organisations like ASH and others have been campaigning for around the world for many years. But it really got going in the UK in 2008. We commissioned the first research on young people in the UK showing the impact of plain packs. And we also published a report which was endorsed by over 100 organisations called Beyond Smoking Kills, which set out a range of recommendations to government. And at the heart of that was standardised packaging. But it still took a while before any government was willing to take this on board. And finally, in 2012, the government consulted on its introduction. But they still weren't convinced they needed to go ahead until 4 peers in the House of Lords tabled an amendment to the Children and Families Bill. And that amendment was receiving a lot of support, both in the House of Lords and in the House of Commons. So the government decided it needed to take it on board as a government amendment. And it passed at the primary level, but they also at that time decided they wanted to get more evidence. So they commissioned Cyril Chartler, who was an eminent paediatrician, and he went to Australia to look at what the impact had been there and looked at all the evidence from all around the world. And I remember talking to him after his report was published, and he said, when I went into this, I knew nothing about tobacco, and I really wasn't convinced it was going to have any impact. But I went to Australia, I saw the impact of packs, I saw what it was doing encouraging smokers to want to quit, and also what the tobacco industry was doing to fight it, and I knew it was the right thing to do.
So that got us the national legislation. I remember at the time there were public health professionals up and down the country who were involved in advocating for standard packs. So, Shirley, we've had that national action. What should the local action be now?
Well, there's loads, I think, of opportunity with plain packs for local communities and particularly local authorities who are responsible for the public's health in those communities. I mean, smoking is still the leading cause of death. And in fact, the other thing we know, which is really interesting, is that 80% of people who smoke want to give up, and we should be providing them with services that help them give up. One of my biggest concerns has always been about the health inequalities argument, because we know that the preponderance of smokers in local communities are from the most disadvantaged background. The ill health falls disproportionately on those who are the poorest in society, and surely we shouldn't be allowing that to carry on. So that's another imperative. But in local communities, it also affects the local economy quite a lot, because you've got people who are off work because they're ill due to smoking-related illness, so they're at home or in hospital, or they're taking cigarette breaks. So for employers, there's a particular, I think, push to help people quit smoking. Then you've got the cost to the NHS and local services of people still smoking, huge amount of cost to the NHS from smoking-related illness. And what's often not talked about is the cost, of course, in social care, where people are entering social care earlier than they might have done because of the plethora of social issues and physical illness related to smoking. So all of these things, I think, are reasons for local opportunities.
So health inequalities is a big issue both for ministers and, of course, for the Prime Minister.
Well, yes. I mean, in her inaugural speech, the Prime Minister committed the government to fighting against the burning injustice that if you're born poor, you'll die on average 9 years earlier than others. And half that difference is down to smoking. So I think both at national level and in local government, health inequalities is a really key issue. And the other thing is that poorer smokers are likely to be more addicted, and therefore they're more likely to need help in quitting. The stop smoking services can increase your chance of successful quitting up to 4-fold. And the good news is that for the first time on these new standard packs, there's a link on every pack to say get help to stop smoking and where to find that help, which is encouraging smokers to use the services.
But first, another big priority is NHS sustainability, and there are plainly very big savings to be made in reducing smoking-related illness. But John, what's the role of the NHS, of secondary care in seizing this opportunity?
In secondary care, there's a very important role to play, which is to institutionalise the delivery of stop smoking interventions. It means asking all people admitted to hospital whether they smoke and then delivering the care that they need. There are over 1 million smokers admitted to hospitals in the UK each year, and what we should be doing for those smokers is delivering what NICE recommended in their PH 48 guidance in 2013, which is to make sure that all smokers are seen by a trained behavioural counsellor within 24 hours of admission and prescribed stop smoking medications, and then followed up through their admission and after discharge to sustain quitting.
Now, Deborah, you were just telling us about concerns that you have about the ability for the system to deliver that because of cost pressures. Do you want to say a little bit more?
We've all seen what the cuts and the impact the cuts are having on local authorities. What we're trying to do is actually provide local authorities with the evidence about why this is an important thing for them to invest in, because there are few areas of investment that provide greater returns than tackling smoking, not just to the NHS, but also, more importantly, to local authorities and to society as a whole. You know, we have a tool on our website. There's a local calculator which enables local authorities to look at all those costs and how they bear down on their authority, and also the amount of money being spent by smokers in their community, because that's money that goes up in smoke that could be used more productively on other things.
So a big role for local authorities, a big role for secondary care, but primary care too, John?
Primary care see an awful lot of smokers every year, and the same approach should apply in primary as in secondary care, which is that establishing whether somebody smokes and then acting there and then, striking while the iron's hot to make sure that advice is delivered and stop smoking medication prescribed and follow-up arranged. Now, arrangements will differ in different primary care services according to their facilities. It doesn't matter who delivers the service so long as it is delivered, and at present I'm not sure that it always is.
That's interesting. So, Shirley, I'm going to turn to you because, of course, one issue that we can't ignore is electronic cigarettes. What do you think the role is for electronic cigarettes in this whole issue?
I think there's an increasing role for e-cigarettes in this issue, and Public Health England produced its very important evidence-based report on e-cigarettes and their effectiveness last year, which we all endorse. And I think it's what we should be looking at is to say, how can we get smokers to use the tactic or whatever works best for them. And a new tool in our toolbox is e-cigarettes, which have proved to be very effective. And let's make sure that our smoking cessation services and whichever health professional is involved in helping you quit, that they understand the important role of e-cigarettes and that we're supporting people to use those to quit. Because we want our communities overall to be healthier and to improve the environment, and stopping smoking will do that.
And I think another really important point is that the stop smoking services are as effective as ever, but what we need to do is maintain the throughput. And we know that a lot of smokers are approaching services who are using e-cigarettes and want help. And where those services provide them with support and encouragement, they're actually increasing their throughput and also increasing their success rates, because the evidence seems to be that smokers who are using e-cigarettes are not less effective at quitting, but in fact may well be more.
So interesting. E-cigarettes are by far the most popular way of quitting, but
Yeah.
local stop smoking services remain the most effective. Well, I think that's a good place to stop. The arrival of standard packs opens a window of opportunity to help English smokers to quit. Let's ride that wave. The government has done its bit by providing the legislation. Now it's for the rest of us to make the most of the opportunity. So do please take the time to explore this edition of Health Matters. It sets out the evidence on standard packs. It describes what local authorities and health professionals can do. And it includes case studies, blogs, video discussions, downloadable infographics, and slides you can use in presentations and in conversations with colleagues. Thanks for watching.